Hi everybody, my name is Jason Schultz and today we'll be discussing physical activity promotion in older adults. So first, did you know that 31 million older adults over the age of 50 are inactive and more than 80% don't get the recommended amount of physical activity in their daily lives? So why does this matter? Why should we care that they're getting enough physical activity? So compared to less active men and women, older adults who are physically inactive are at a much higher risk for many different diseases and ailments. So they also exhibit higher levels of functional health. So people who do get enough physical activity have less chance of falling, of getting hurt, of a lot of these ailments that people that are physically inactive get. So just a couple basic vocabulary words as we go through these slides and everything. I'll let you go ahead and read them through. First one being moderate intensity. So it's just the level of how much you're putting into your workout or your physical activity that you're doing. So there's moderate intensity and also vigorous intensity, which would be like giving it 110%, going as much as possible into a workout. So range of motion is just how far you're actually moving your joints and your muscles and everything. We have type 2 diabetes, which is just a specific type of diabetes. We have metabolic syndrome, cardiovascular disease, and self-efficacy, which is just a person's belief in being able to execute different things and behaviors. So some more basic vocabulary words, just heart disease, coronary artery disease, issues to do with the heart, heart attacks, high blood pressure, or hypertension. So a stroke, which is due to a blockage in the brain, high cholesterol, osteoarthritis, and osteoporosis, which are bone disorders. Diabetes, which again, there was the type 2 diabetes earlier. This is just the overall diabetes. Coronary heart disease, and high triglycerides, which lead to like high cholesterol and stuff. So we'll skip this guided practice for now, but definitely remember some of those vocabulary words. So what are some guidelines associated with physical activity? Well, pretty much physical activity is any type of physical movement or weightlifting, running, even just walking or doing leg kicks. It's just whatever you feel comfortable doing, whatever you're able to accomplish. And since this is physical activity promotion for older adults, some people do have ailments that prevent them from doing certain activities. Some of them can't ride bikes, they can't go running. So they can be limited in their scope. So it's anything you are able to do effectively without further injuring yourself. So why is physical activity important? Well, we discussed this a little bit earlier in the slides, but you have an increased chance of living longer, improved ability to do daily activities, simply just washing your dishes or sweeping your floors, anything like that. Improves your mental health, strengthens bones, muscles, reduces some risk of cancers, reduces diabetes, cardiovascular disease, and weight management. And these are very similar for all of us, not just elderly. So some more risks: obesity, heart disease, coronary artery disease, high blood pressure, high cholesterol, strokes. So a lot of those vocab words that we went over, as far as the medical terms, are all risks associated with physical inactivity. So here's some more of those. So depression, anxiety, those are big ones. So what are the benefits of physical activity? We went over these again. So, sorry, a little bit of duplicates in the slides. So, but yeah, improved activity, improved mental health, and strengthened bones and muscles. So, and then you have reduced risks for everything we went over as well. So, reduced risk of cancer, reduced risk of diabetes, of heart disease, of strokes, of falling, many different things. So, skip over that one too. So, in the elderly population, what are some of the barriers that they might have to getting out there and staying physically active? So, discomfort and pain is a big one. As you get older, you get more aches and creaks and everything. So, fear of injury is a big one. Falling is my wife's a physical therapist. She works in a SNF. She works with elderly people all day long. That most of them are there because they fell. Just they're older, they can't do everything they're used to doing, and so they just fall, and they can't prevent it. But being physically active would help with that. So what are some common solutions to these barriers? So for someone with low self-efficacy, so someone who thinks that, I don't think I can do this, I can't get out there, I can't be physically active. Well, having more local volunteer services, teaching caretakers and families basic things that they can help out and do to increase physical activity in that individual, and just more praise and more encouragement. So when they have fear of being injured, so making sure to teach the exercises properly is a huge, huge thing. If you do an exercise improperly, you greatly increase the chances to hurt yourself. So make sure they go over the various safety measures and emphasize the importance of having a partner for physical activities is great, because if you do injure yourself, you have someone there to help you out, or to call somebody, or to assist you, or say, hey, let's slow down. So, lacking self-management skills. So making a goal-setting charts, a step counter, a little Fitbit or something that most people have nowadays is a good one. So setting those goals, understanding them, and working to follow through with them. So guided practice, we'll skip this one too. All right. So how much physical activity should an older person do? And as we're going through this, maybe take a look at it and see if you even meet the requirements for an elderly person. This is 65 years of age and up. So the CDC recommends that 2.5 hours of moderate intensity aerobic exercises. So aerobic exercises are going to be walking or running if they're able, tennis, swimming is a good one. So every week. Muscle strengthening activities on 2 or more days as well. That work all major muscle groups. So you want essentially just break it into like upper body, lower body, and then maybe arms, core, legs, and go from there. So 2.5 hours, that's a pretty long amount of time to be doing that through the week. So it can be broken down to 1 hour and 15 minutes, but it has to be at a vigorous intensity. So that would be running or doing something that's working up a really good sweat while you're doing it. So, and then again, the muscle activities on 2 or more days a week. So what are the different types of physical activities that would be appropriate for older adults? We have resistance training. So this is light weightlifting, which would be just weights. You have the resistance bands here, if you can see them. Those are great. Even gardening would work. Some people, when they have physical impairment, ailments where they're not able to do all the strength training or lifting weights, using your body weight or using a chair for even exercise is a great way to work around some of those physical ailments. So Tai Chi is a great activity for older adults, especially when it comes to balance. It's very concentrated, slow moving movements that really help with balance and preventing falling, things like that. It's one of the things my wife states in her SNF that gets recommended a lot for older adults. So, and then another type would be endurance training. So that's just walking, dancing, golf, water aerobics. And then a big thing here, remember to always choose an appropriate physical activity for yourself. A workout that is at your own pace, that you feel comfortable with, and that's not going to cause you any more harm. If you get hurt, you're only setting yourself back and maybe further preventing yourself from being able to continue exercising, continue to do other things. So that's a big one we want to keep in mind there. The next thing I want to talk about, or it's actually activity we're going to do, is just compare the different types of physical activity. So I want you to take 3 to 5 minutes and just thinking about the different activities I discussed, and then different activities you may know about. I mean, we're all have our different experiences in life, so maybe you know some that might work better than what I've talked about here. And after that 3 to 5 minutes, we'll come back and discuss it. Okay. So, Jeffrey, would you please give out one of the physical activities you feel would be best suited for older adults?
Water aerobics.
Water aerobics, that's awesome. That's a great one. What are some of the different types of things we would need for water aerobics?
Maybe a pool noodle or a kickboard.
Those would be great. They help with the buoyancy and staying upright in the pool. And there's a lot of local community centers and even gyms and stuff that do water aerobics for older adults. So that's a great suggestion. Thank you.
You're welcome.
So the last slide we will go over today for this is just a little bit independent practice and discuss is just what would a normal 5-day workout routine look like for an elderly person to make sure they meet all of those requirements that the CDC has for them. So it would begin with 15 minutes walking every single day, just getting out there during a 5-day week, Monday through Friday, 15 minutes walking. Incorporating in there twice a week an extra 15 minutes of muscle strengthening exercise. So this could be going out to a store, getting some resistance bands, and using those, even some push-up, whatever you feel comfortable with that's working your muscles and building up a little bit of sweat. And then 3 times a week as well, 15 minutes of moderate physical activities such as dancing, those water aerobics, that could be going out running as well. It all goes back to whatever you feel comfortable with. So, and then lastly, every single day, 5 minutes of just a nice cool down of Tai Chi, where you can kind of help with your balance and go through those nice, slow, smooth movements. That's going to wrap up my lecture. I'd like to thank you all for coming today, and have a great rest of your week. Thank you very much.